Thank you, Mr. Chairman. And it was also good to see your membership yesterday. I appreciate the opportunity to visit with you. Commander Schmidt, thank you for being here today. We look forward to your testimony, and we appreciate you bringing your leadership team in. I want to acknowledge Roger Hagan, Montanan, who's part of the Legion. Roger, good to have you here. Yeah. Roger's a little bit older than I am, but the longer that I serve in a position, the closer we get to being the same age. Many of the Montanans are headed back to Montana, and that's unfortunate for us here today, but you can't blame them. But it's good to see you here, Roger. Commander Schmidt, we're here today because Congress should take our cue from you. The American Legion provides critical perspective on how to best address the challenges of our nation's veterans. Your membership also provides critical services to our veterans and their families. Whether it's helping veterans transition to civilian life, finding employment, or file a disability claim, the American Legion is there and it is making a difference. As I told the DAV yesterday, we hold these hearings because only VSOs and not partisan political groups or pundits on cable can help Congress focus on its oversight and legislative efforts to ensure that veterans have access to quality care and benefits. That means taking cues from you on how to hold VA accountable, ensure that VA has the capacity to meet the needs of all veterans, and fixing the choice and community care issue. On this last point, in a rare demonstration of bipartisanship, Congress enacted the Veterans Access, Choice, and Accountability Act of 2014. This legislation sought to bolster the capacity of the VA to better directly serve veterans and to expand veterans' access to community care when the VA was incapable of providing that care in a timely manner. Now, 2.5 years later, the VA is confronted with looming and dramatic funding shortfalls and a choice program that, at least in Montana, it just flat isn't working. We need to fix the program so it makes more sense for both veterans and community providers, and I am pleased that there appears to be agreement among all the major veterans groups on a path forward. Rather than just giving a veteran a card to seek care in the private sector, the path forward is an integrated network of VA and community providers. This means VA should continue to serve as the coordinator and primary provider of care while the private sector fills in the gaps. I know that the American Legion will be at the forefront of this discussion and will help Congress get to where we need to be. Commander Schmidt, again, welcome. I look forward to hearing your testimony and working closely with you and the folks on the dais to do right by our veterans. Thank you. Thank you, Mr. Chairman. Commander Schmidt, the choice program has been a wreck in Montana, and I don't think it's been much different anywhere else. Would you agree that it's really in need of reform before it is extended or expanded?
Thank you, Senator. That's a very good question. And the choice program was a program that kind of helped veterans like myself. As Senator White didn't tell you where exactly Hines, Oregon is. It's out in the middle of eastern Oregon, far, far away from a lot of places. And when that was choice program was first initiated, it wasn't quite clear of how that was going to operate, who had to get authority to use or go to their choice, their preferred physician. But it does need refining to have more specifics, more details, so the veteran understands how that program works and what they need to go through to be able to use that without a lot of red tape.
Yeah, thank you for that. I want to touch a little bit on the chairman's question on suicides, and maybe you want to direct this to someone else, Commander, but the suicides are too high. That's unarguable. Is there anything that the American Legion has come up with as a recommendation to the VA to reduce the number of suicides?
Well, Senator, one suicide is one suicide right. Too many. And I would ask our Director of VA&R, Lou Selly, to address
sure.
that.
Ranking Member Tester, thank you so much. And it's an epidemic, and it's an epidemic that we take seriously when we do our system worth saving visits. Some of the things that we found is some of the hospitals are doing a very great job, a diligent job on following up with some of their mental health patients and just following up with some of their patients who exhibit some depression. Some aren't as diligent as they could be. the very first thing that we need to make sure is that we're reaching out to these veterans. Veterans who present themselves at the hospital, veterans who call our suicide hotline, veterans who tell their buddies that they're having some problems, they need to be followed up with. And if we could do a better job at that, we'll do a better job. And again, as our chairman mentioned, addressing our mental health and depressive issues.
Super, and I'm sure that Dr. Shulkin heard that as you said it. As I mentioned in my opening remarks, Congress needs to take its cues from you and the other VSOs, and for the most part, you've all been on the same page, and I appreciate that. Secretary McDonald did a good job establishing communication. The question I had for you, and I had the same question for the DAV commander yesterday, have you or any representative from the American Legion had the opportunity to personally meet with the president?
Senator, we have not yet. We're anticipating in the opportunity to visit with the president and share some of our views like we're sharing with you today.
You have made that request?
I'm sorry?
You have made that request to meet with
We
him.
have made it, and we're following it very closely.
Well, I don't want to get bucked off, so I'll yield my time. Thank you, Senator Bozeman. I just want to just say, first of all, there's so many more questions that could be asked, and but on staffing, on budgeting, on the hiring freeze, on women's veterans, what I just want to touch on very quickly with you is privatization. Senator Tillis started out by saying nobody wants to privatize this up here. But if you listen to some of the questions, it sounds like they want to privatize stuff up here. And so your input is critically important on this issue. I said a couple times today, we need to take your cues from you. Why? Because you've been there, you've done that. And so make sure your voice is heard, make sure you hold us accountable. God bless you all.
Thank you, Senator.